I'm Dr. Suresh Ramalingam, medical oncologist from the Winship Cancer Institute of Emory University in Atlanta. How do we approach the issue of bone metastases in patients with lung cancer? As you're well aware of, lung cancer, if caught early by CT screening or other methods, can be cured with appropriate therapies. However, unfortunately, majority of the patients still end up being diagnosed with a more advanced stage disease at the time they are found to have lung cancer. When we look at how lung cancer behaves, typically it can spread to many organs. And among the most common organs lung cancers can spread to are the brain, the liver, the adrenal glands, and the bones. So the bones are a fairly common place for lung cancers to spread. In fact, 20 to 25% of patients with lung cancer will have involvement of the bones some point during the course of their disease. Now, what are the consequences of having lung cancer spread to the bone? One of the things that can happen is as cancer metastasizes or spreads to a bone and starts growing there, it can cause erosion or destruction of the bone. And that can be associated with pain. For many patients, pain could be the presenting symptom for the bone metastases. Depending on which bone is involved, the site of pain is variable. For instance, if the cancer spreads to the rib, then patients may present with chest pain. If it spreads to the vertebra, then it could present as back pain. Sometimes the cancer can spread to the pelvic bones and patients may present with hip or pelvic pain. So pain could be the presenting symptom for patients. The other problem that bone metastases can cause is as these tumors grow in the bone, that can cause pressure effects on the surrounding structures. And one of the things we worry about the most is when there is cancer involving the spine. If it grows, it can potentially invade upon the spinal cord. As you know, spinal cord is a critical structure. It provides nerve supply to most parts of the body. So if the cancer puts pressure on the spinal cord, one of the more serious consequences is it can cause paralysis. So anytime there is cancer involving the spine, one has to recognize it and manage it appropriately to prevent that spinal cord compression from emerging. And for patients with lung cancer, if ever they notice any weakness in their legs or hands, or notice anything unusual neurologically about their legs, or severe back pain or neck pain, it is important that they communicate with their physicians right away so that it can be looked at and managed appropriately. Now, how do we manage bone metastases? Well, the first thing is to see how symptomatic the bone metastases is. If the pain is very severe, or if the bone metastases involves the vertebra and we are worried about spinal cord compression, we would use radiation therapy. Radiation therapy is given specifically to the site of the bone metastases, and that can cause improvement in symptoms, and it can also potentially slow down the further growth of the spot in the bone. There are different ways by which radiation oncologists could approach this. Sometimes they can do the radiation over 1 sitting, or 5 sittings, or 10 sittings. It depends on the specific site of involvement. The good news is radiation therapy is often very effective in controlling pain. The second way we manage bone metastases is to treat the underlying lung cancer with systemic therapy. This is a form of therapy, either chemotherapy, immunotherapy, or targeted therapy. These are agents that are intended to address the cancer no matter where it is, whether it's in the lungs, liver, bone. The systemic therapy is an important component of managing bone metastases on top of local therapy whenever it's appropriate. And finally, we also have in our toolkit drugs that can reduce the complications related to bone metastases. So these are drugs that we give in conjunction with chemotherapy, and these agents can reduce the risk of fractures. It can reduce the risk of pain related to bone metastases, or it can delay the emergence of complications related to bone metastases. So these agents are what we call bone protective agents that are administered. Finally, one key point to remember is sometimes the bone metastases can be in a critical organ like the hip, where if it causes fracture, that could threaten the mobility of the patient. So rarely, if we find bone metastases in a critical organ like the hip, we would have the patient visit with the orthopedic surgeon to determine whether some sort of a preemptive surgical procedure is needed to stabilize the hip so that the patients do not experience fractures that could threaten their quality of life. So overall, bone metastases is a common problem, but with effective treatment and preventative measures, we can preserve patients' quality of life and improve symptoms and ultimately improve their overall lifespan.